Stand by.
Hey, Jess. Hey, Mark. Good to see you. Sarah, hi there.
Hey there.
Hey, guys. Hey, Admiral. Hey, Richard.
Hey, good morning.
What's up, guys?
Richard.
Okay, we are on.
We are live. Okay, good. Well, good morning, everyone. Good to see your faces virtually and hopefully soon in person. But I will call the meeting. This is a special meeting of the Finance Committee of the Board of Visitors. And we are meeting by electronic means today as permitted by Virginia law during the state of emergency declared by the governor due to COVID-19. This meeting will be held in open session and is being broadcast live, is being recorded, and will be posted on the EVMS website. All votes taken today will be done by roll call vote. And I would ask that you mute your video while not talking just to prevent feedback. So with that, again, welcome everyone, and thank you for being here for this special meeting this morning. The main purpose of our session today is to review the FY22 budget. Let me say up front, we're not going to be actually calling for a vote on the 22 budget today. The purpose is really to allow Helen and her team to discuss it with us, and then it gives you time to ruminate on it if you so desire, and we will actually have the official vote on that budget during our Finance Committee at the June meeting. We do have a couple other items of business to get to before we get to that presentation. The first one being the approval of the minutes from our last session on the 16th of March. And this one is an action item, so if there are no issues with the minutes, I would ask for a motion to approve.
So moved.
Thanks, Ashton. Second by Sarah. Thank you. Linda, if you could do a roll call vote.
Respond with yes or no, please. Admiral Bianchi,
Yes.
Dr. Bibbins, Sarah Bishop,
Yes.
Dr. Emery,
Yes.
Mr. Hart,
Yes.
Dr. Latanzio, Mr. Lewis,
Yes.
Mr. Litton,
Yes.
Ms. Moore, and Dr. Wagner.
Yes.
Motion passed.
All right. Thank you. Okay, next up, we'll have Camille walk us through a update on FY21. We'll look at March's results and estimates of where it looks like we will end our fiscal year. So Camille, over to you, please.
Yeah, thank you. And I just have a quick brief update on the financials because we've consistently reported this fiscal year a very strong performance. And if you want to turn to the statement by mission on page 16 of the Diligent Board book, you can see that the core bottom line is very strong, 5.7 million. And the biggest contributors to the positive bottom line is the salary and fringe savings of open positions. And additionally, the medical group is having a very good year. That's really all I wanted to say.
Excuse me, what page did you say?
I'm sorry?
What?
Medical group is having
What page did you say?
Oh, page 16.
Page 16,
Okay,
Betty.
thank you.
Camille, I don't know if your mic is, you're coming through very kind of garbled a little bit.
Oh, goodness. I'm so sorry. I'm in Waitzer, so.
Okay.
Is it better?
That's better now, yeah. Whatever you did, that's better. So it might be
Thank
worth running
I'll go
your
through that
statements again.
Yeah, so on page 16, you'll see the statement of activity by mission. And the first column is the core. The bottom line for core is 5.7 million, which is very strong financial. We've been consistently reporting that all year. In the main contributors to that bottom line is the salary and fringe savings of open positions and the fact that the medical group is having a good year. I hear beeping. Is that coming from me or no? Okay.
No.
So if we could move on to page 37, the net access for fiscal year 21, the projection. Because of the strong bottom line that we have, we are projecting to transfer 5.5 million into the EVMS reserves. And as a reminder, the reserves are used for institutional needs determined by the president. And that's really all my reports, unless someone has any questions.
Any questions from the committee?
Great.
Okay, thank you.
Oh, hold on, one question,
Yes.
Admiral, I'm sorry. Page 27, just for my own information. Page 27 is the EVMS reserves, and it may be for Dr. Homan. Under expenses, the President's Institutional Fund's COVID resiliency bonus, does the 3.4, almost 3.4 million, is that what we got for COVID? Versus the projected 2.1, or explain that to me so I know what it is.
Well, we provided a COVID resiliency bonus to faculty because of the extraordinary work that was done this year. That was taken out of reserves to provide as a one-time bonus to all faculty and staff. And so we're replenishing the EVMS reserves this year. And there's some funding that goes to a president's fund. So it's consolidated. And when Helen provides her report, you'll see it's consolidated under one sort of reserve line item that represents the total amount of active reserves that we have.
Wonderful, thank you. And what did we get for COVID? What do we get from the feds or from whomever?
Well, as you know, we tried to get a PPP loan for the medical group, but we didn't qualify, so we had to send it back because we were afraid we were going to get audited, and so we didn't want to take the risk of that. We did receive some funding that was provided to the state for PPE, which is the personal protection equipment, and then we also received some money for student aid, for student financial aid. We just learned that there's another little tranche we're going to get there to help to support some of the students that were burdened during that time. We get I think about half of it, and the students have to get distributed about half as well. That's about 400,000 on each side of that ledger that's been provided. So most of the funding that we received really was for operational expenses that we had as a result of COVID, for protecting the faculty staff, for housekeeping, for disinfectants, for the air handlers, to be able to get antiviral filters in. All those things were the things we expensed those dollars on. Helen, do you have any other details you'd like to say?
No, just the dollar amounts. So we've gotten about $1.9 million from the feds, of which 776,000 was for student aid, and the balance was for institutional support that was just mentioned. That's from the feds. And then we got $2.4 million from the state. And that was specific to that was reimbursement of PPE expenses, direct expenses. And in addition to that, we were able, as Dr. Homan just alluded to, we were able to get in December a new air filtration system in all of our buildings that it had been proven to kill the virus, and and helps with the air recirculations. So we were very pleased with being able to do that in all of our buildings, because that's just not for COVID time period. It will be a long-term asset that we'll be able to have.
Good. Can I ask
One
a
more
question?
question. Dr. Stoddard mentions PSPP. What is that?
I can speak to that. As you may recall, there's a federal supplemental payment program, and 8 years ago I went to the governor and then eventually was able to get the federal supplemental payment program, it's called. And so it's a supplemental payment program that we pay to Medicaid in Richmond, and that gets doubled through the CMS and comes back to the practice plan. That's created about $4 million a year. And now it's increased to 6.5, I think, this past year. And so those are incremental funds that come from the feds that goes directly to the practice plan that help to provide the resources to be able to provide competitive salaries, because when I came here, we had faculty members being paid at the 15th to 25th percentile. And we were at risk for losing a lot of faculty, and those dollars were distributed in many ways to be able to capitalize the practice plan and support the clinical faculty.
Thank you.
A couple questions I have.
We used to call it the UPL, Sarah.
Yeah, okay, thanks.
A couple questions. Helen, related to air handling systems, I'm familiar with those. And on another board I'm on up in Charlottesville, we put one into old school system. Did we get money from the state or federal government for those systems, or do we have to pay that out of reserves? And how much was that?
It was, gosh, I think it was pushing 900,000, and yes, it was funded through the state.
That's great.
We specifically asked for that in the second round at the tail end of last year, and it was something that the state was very supportive of, because they felt like that was one of the best ways to protect the, to have the protection indoors was to have better air filtration systems.
That's great. And then this other question, maybe Dr. Holman can answer. On the salaries and benefits savings due to vacant positions, just address the long-term implications. How many vacant positions are we talking about? And, in terms of the whole academic, in terms of academia, how has it affected our operations?
Well, this past year, as you may recall, during COVID, what I did was I sort of froze things in place during the real crisis back last March through the summer, because we didn't know what that was going to have an effect on our operational budget. We typically have these dollars we call lapsed salary dollars, or that we've had every year, which are open positions that we have. Some of them are funded through the strategic plan, some through operations. So if they're left open, essentially, those dollars drop to the bottom line and can be distributed back in part to our net assets and in part back to EVMS reserves. The number of faculty, I don't have offhand how many we're actually recruiting. Some of them are for replacements. Some of them are for new faculty. I can tell you that in the report to the board that I'll give you in another couple of weeks, we've expanded our enrollment of students by 80% in the last 8 years, and we've increased our faculty complement by 3%. So we've tried to work as best we can to work within the productivity constraints we've had, but now we have some money through the strategic plan that we're still investing in new faculty members, and I've created new overages to be able to develop the clinical educators to be able to be requiring us for the LCME for accreditation. So we can give you an idea as to what those positions are. Helen, do you have a list of those individuals or those open positions, those billets, so to speak?
I don't have a count of the actual positions. I just have relatively the dollar amounts in the various buckets. But we can certainly get that, an inventory of the open faculty positions. Several of them are most of them, if not all, are being actively recruited now. And we do have an expectation that they will be filled next year. A prime example is during this fiscal year, we had the internal medicine chair position, and it was filled in January. And in his startup package, he had several positions that he was able to recruit. So that contributed to that. Just that one recruitment was contributed about $700,000 this fiscal year to that savings. Right. So we can get some narrative and some statistics on the actual open position, but I do know, as Dr. Homan said, we did have a temporary hiring freeze that delayed some of the initiative, as well as some delays that we encountered because people were, once focusing on surviving COVID. And so it did put some delay on some of the recruitment efforts, but they have been opened up now. And I know that, for the strategic plan and the faculty recruitment, I've seen a lot of activity recently. So we are anticipating that is going to be something that we will not see next year. And we did budget the positions because with the expectation that they were going to be filled.
Yes, that's the most important. Thank you. I appreciate that.
Okay. Any other questions on the FY21 status? All right, hearing none, then we will move to the next order of business, which is a review of the FY22 budget. So I will pass the baton over to Helen. I think if you reviewed the budget, you will see there's a modest increase over FY21. The budget kind of represents a return to a post-COVID environment, return to normal for several activities. It also has a tuition increase included in it as well. So again, this is a informational brief at this point, and if you have any questions, please raise them, and then the expectation would be that we will take a formal vote at our June session on the budget. Okay, so Helen, over to you.
All right, thank you. And I will share my screen. Hopefully everybody can see this. This was provided in your package as well as the detailed budget package that we prepare annually for approval. This slide reflects the operating by mission. The total budget is $278,000, which is an increase over projected actual of $9 million. The biggest areas that the increases include are in core, which is an inflationary increase, as well as GME and research. So I will walk through the core mission. If I can get my screen, there it goes. Okay, so the total available I skipped too many. So as indicated in Camille's report, we're projecting our core net excess to be $5.8 million this year, and that's mostly due to the salary savings that we just discussed. In addition, we are increasing revenues this fiscal year to be an increase of $3.3 million, which I will walk through in more detail in a few minutes, for a total available of increased revenues of $9.1 million. So we start with, when we're looking at the expenses, so we start with that $9.1 million and look at the expenses that we will be using those funds for. And included in that is the $7 million that we're projecting of the salary savings that were incorporated in fiscal year 21. As I just reported, we do expect those positions to be filled at some point during the fiscal year, so we have budgeted them. In addition, we have a $2.8 million increase in salary, which I will talk through in a few minutes. And then the other major variance is the transfer from EVMS reserves of $4.9 million for a total expenditure increase of $9.1 million. And again, I'll walk through various components in the next slides. So the $2.8 million increase for salaries is mostly made up of the $1.4 million increase. So last year we did not have a merit increase because there were concerns about how COVID was going to hit us financially. As Dr. Homan just reported, we did offer our employees a one-time bonus of 3% done in 2 increments, one in September and one in January. And this was to recognize the efforts of our employees that were working really hard during COVID, and he wanted to recognize these efforts. And so we did provide that as a one-time expense from EVMS reserves, a 3% bonus. But this year we are budgeting an increase of $1.4 million. And this is about a $2.9 million impact on all of our missions, but for core it's 1.4. In addition to that, we have some planned faculty recruitment or planned growth in health professions programs to accommodate the growth in their various programs, as well as some new positions that we're hiring, which includes some recruitment efforts for the health profession programs to help with their recruitment, as well as some positions that were looked at in fiscal year 21, but were put on hold because of because of COVID. So we are proposing that we hire those positions, as well as some small adjustments that, for promotions in equity and exceptional increases for our staff that come up, that arise from year to year. The core budget includes it is break even, but we do have $1.1 million that will be going to the president's funds for one-time use. Those are for things that occur during the year so Dr. Homan has some funds available. A lot of times these are used for to provide support to the chairs. He's used this for some renovation supports for some of the areas that need it, various things that pop up that are not planned, as well as we do annually budget a small contingency reserve. It's $169,000. We are budgeting a tuition increase. The MD increase will be 2% for in-state and 2% for out-of-state. So this is the first time since 2013 that we are budgeting a out-of-state tuition increase. In 2011, we had the highest out-of-state tuition out of all the private schools in the country. And so at that, starting in 2013, we stopped increases for the out-of-state. And then in 2019, we passed our tuition was lower than the median. So we did not do an increase in 2019, 20, or 21, but it's time now that we are below the median of all the private schools to start doing some incremental increases. And we will continue to monitor how we compare to our peers and make sure that we don't get back to a 2011 and get out of whack with what our peers are doing. For the PA program, we are budgeting a 2% in-state increase and a 0% out-of-state increase. We are budgeting 0 for their out-of-state because this program has gotten a little out of whack compared to peers, similar to what the MD program did. So we will continue to monitor this as well and get that more in line with what other programs are doing. And then the other programs in the health professions, most of them are 2% in-state and 4% out-of-state. State appropriation, when we compare to fiscal year 21, we are looking at a variance. This is due to an we get some indigent care money, and it's allocated between us and the medical group. And the medical group had a decrease in the amount that they were able to use because of the patients that they have that normally would have qualified for indigent care no longer qualify because they are able to get insurance under the Affordable Care Act. So this is a trend. We have seen this go down, the eligibility go down of their patients year after year. But in fiscal year 20 was the first year that they were not able to use all their funds. So it moved from where they were over into, it got reallocated from us to them, or for them to us. It does not mean that there was any change in the amount that we received. It's just an accounting thing on who recorded it on their books.
Helen?
Yes.
Sorry to cut across you, but I just had a question. You may need to, you can answer it here, or if you have it somewhere else, that's fine. Under state appropriations, before I forgot, what amount, we've been hearing that we have been chronically underfunded from appropriations from the state. What amount and in what areas have we been underfunded, and by what amount would we have we been deserving to get from state appropriations?
Yeah, that's a great question. So the amount, so we get over $30 million a year and a portion of that is indigent care, but a large portion of it is for education. And in that formula, there is a calculus as to how many students you have, how many faculty you have, and then they calculate how much support you should get for education. And EVMS, if you do that calculation, and the last time the state did it was off of I believe fiscal year 19 numbers, we were $1.7 million less than what that calculation should have been. So, I mean, what the calculation was. So we are underfunded by $1.7 million from looking at the, based on the fiscal year 20 numbers. And with the expectation that that probably has grown since then, but the state has not redone that calculation.
And we have brought this to their attention?
Absolutely.
Okay.
It is something that we continue to talk about and request and try to get on par with what the other state institutions are being provided. Because that is the portion that goes for education. And it is one of the most critical support components that we receive, because it helps us provide the necessary tools and faculty and education to our students.
And what is the rationale as to why we have not gotten it, or has there just been no response?
I can speak to that, because I've been before Richmond for 8 years trying to get increased funding for us. And we did get the funding for the building, which was a big win for us, a few years ago, to get the Waitzer Hall $60 million, but the operating dollars continue to be down. It used to be that ODU and we were the only two higher educational institutions in the entire Commonwealth which were below the base funding, the formula funding. Now we're the only ones that are below it. And we've made the case for that each year. We actually have a briefing document we send to the legislators, the General Assembly members, when we meet with them. And if you'd wish, I can go ahead and send that to you, which gives a cumulative serial amount of the deficit over the last few years, and gives a very quick summary of what we are, what we're asking for as well. So that may be beneficial for you. Let me know if you'd like to have that sent to you.
Yes, I would. And still, what has been their response, or has there just been no response?
There's been an effort to try to do it, but the will of the legislature, of the General Assembly, and the governor's office has not been to fund the school, in some ways because we're it's kind of a hidden gem in Hampton Roads, and a lot of the power in Richmond now is in Northern Virginia, and they don't have as strong an advocate. We did have a strong advocate in Chris Jones when he was the Appropriation chair, and now it's been diluted. So we're going to continue to work on that. We're looking to see if we can get another legislative lobbying effort for us. We actually had a meeting yesterday to try to identify another firm that can help us in projecting our case and allowing the community here, and more importantly, the community in Richmond, to understand the value that we provide and the justification for getting us at least to that base adequacy amount.
Okay, to be continued. But thank you. Okay.
Dr. Homan, did this school start without state funds? And so we've been started from zero way back when the school was founded, and trying to play catch up is probably part of that problem.
It is. There's a lot of history, and you're right, Mr. Hart, that the school, as you know, was founded by the committee for the community, and the founders were extraordinarily visionary to try to find ways for this community to stand up a school on their own dime, essentially, and they were successful. The other side of that coin is, though, that we never had state funding up front, because the state didn't want to create another medical school that would require a commitment from state funds. And so this community did it on its own, had the courage to do it on its own. And so that has continued. That in some way we're the kind of this unicorn that never had full funding. We've had increased funding over the years, but never to the point where we have a comparable amount for state agencies. And we're trying to work on that as well. But you're right. And, one of the flaws initially, too, was that we didn't have the affiliation agreements with the hospitals in the region that was occurred. So we never had that connectedness, funds flow from hospitals to the medical schools as most are. Notwithstanding, at the time, the leaders of this community were extraordinarily courageous, visionary, and philanthropic in generating $7 million to start up the school. There are not many communities that do that on their own, and they did it. And we bootstrapped it, and we've come a long way since then. And we've made some progress with the legislature, but we're not on par with UVCU, UVA, or other state agencies.
including with the partner facilities, healthcare facilities that we are working with, but we won't go there now.
Right. Well, that's, we have to work with our partners. That's the next step.
Okay, thank
We
you.
come a long way. When I first came here,
Oh,
we had
yeah.
$2 million of funding from Centera. Now we, the affiliation agreement had up to 34, then 31, now 22. But that's 10 times more than it was when I came here. So that's a good thing.
Very good.
So, yeah, so we did request some additional funding this year, but we actually received a small cut. It was $244. So basically we're at the same place we were last year. Okay. All right, it's not wanting to move. Okay, there it goes. All right, so we are also budgeting an increase for facilities administrative cost recoveries. These are indirect costs off of our research awards. This is due to Conrad, an increase in Conrad. As you may recall, Conrad did receive some new funding in fiscal year 21. They received it mid-year, and so this $1 million increase reflects a full year worth of that additional funding. It is offset by $316,000 for cost match and seed funding. So these are funds that were required the cost match is required as part of the award to have institutional funds to put in a match with institutional funds. And then we provide Dr. Don Sells some seed funding so he can continue seeking new awards. And then we have some small increases in the other non-Conrad programs. Auxiliary enterprise income had a net decrease. It includes an increase in our parking revenues, part from staff and then part from the daily parking. This is offset by parking operating expenses. So this whole program, any revenues and expenses is all goes into the consortium. So it is restricted. And then the Hay Club Apartments, we have a $683,000 decrease in the rental income. You may recall in previous meetings, we've talked about in the bond issue discussions that we are renovating the Hay Club Apartments. And that is expected to start in January of 2022. So we will be losing income from January through June, as well as we have lost some revenue or expecting to lose some revenue July through December because we're not allowing new tenants to come in because they would only be able to get the apartment for a portion of the year. And so they would be better off trying to secure a year's lease. We have been planning for this by putting some money away in reserves. And so we will be taking money out of the reserves to offset that decrease. So the net impact to our core operations will be zero. And we'll have approximately $550,000 in reserves even after that transfer to be able to assist with all the unknowns that continue to occur with these apartment renovations.
A quick question, Helen. Are those rentals at a competitive rate or is it subsidized by EVMS and seen as a tool for recruitment of students, underrepresented students? Competitive or subsidized?
I would say it's less than market, in part due to the shape of the apartments. So it's not necessarily hasn't been looked at as a incentive for the students or to help in that aspect. I think the proximity to campus, the fact that the police and public safety continue to monitor it and everything else makes it very advantageous for the students that live there. So I think those are advantages. But it is less than market, and we will look at that and continue to look at that once after they're renovated and in better shape.
What is the average rent for an apartment in Hague?
For a one bedroom, it's $900.
Okay,
And then a two bedroom, I believe, is $1,200.
okay.
Clinical support. So we are budgeting a decrease next year from projected actual. It actually is an increase from the fiscal year 21 budget by $138,000, but a $461,000 decrease from fiscal year 21 projected actual. And that's mostly due to fiscal year 21 being a record high year. So as Camille reported, we have seen a high, a very good year for the medical group. And this is due to their PSPP revenue, as well as, their revenues versus, and a reduction in their revenues have been, consistent, but their expenses have been lower. So their margin has been very good this year. We are budgeting next year salaries and fringes for vacant positions. So if those positions are not filled for the entire year, the clinical margin may be better than what we're budgeting. The budget also includes the reduction in the indigent care allocation. And then other sources is an increase, and this is due to us getting back to some normal activity. So we are budgeting an increase in our simulation center of $542,000, and in our continuing medical education programs that we offer of $112,000. So these are services that we provide to outside organizations that we had not been doing due to COVID. On the expense side, I'm happy to say that we have budgeted a 3% employee raise, well deserved for all our faculty and staff that have been working hard over the past year. Our health insurance is a minimal increase of 2%, or $272,000 for core. I did include in here the plan cost, which is ranges from $57 a month to $174 a month, and that's for a individual non-smoker. And then we've also we are budgeting some increases in expense, and this also relates to us resuming normal activities and going back to a norm that was more reflective in fiscal year 19. Travel, $819,000 increase from where we are this year, and meals looking at $448,000. And then lastly, in core, we are projecting more to be transferred in from EVMS reserves. We are budgeting some operating support from the affiliation agreement, the $17 million that we get annually from Centera. We're projecting to use $3 million of that for our core operations. We will not draw on that if it's not needed, but we are budgeting it as if in case we need it. The strategic plan is $1.2 million. This is as we ramp up all the strategic plans, funding those positions that haven't, are currently being recruited, and other initiatives. Those are being funded by the strategic plan, so we transfer the funding in from those reserves. And then lastly, the academic clinical educators. This was from the previous strategic plan, where we are recruiting academic clinical educators that provide 40% of their effort to educate our students and with the preceptorships. And so that all of these recruitments are in progress, and we'll be increasing the support to facilitate those positions as they get filled. Okay, I'm going to now move over to the GME, the Graduate Medical Education mission. This is for our residency program, and we are budgeting a 2% resident stipend increase, and that is funded by our affiliated hospitals. The hospitals do receive funding from DMAS to support these positions, and then it's passed through from the hospitals to us. And to cover, because the resident expenses are on our books. And this increase will keep our residents competitive in the market. The biggest cause of the increase in the GME mission is that we are budgeting 27 more resident positions. The fiscal year FY21 actual is 360 residents, where we're budgeting 387.
What are the new residencies in?
It's just additional positions. So it's not that we have any new, it's just that this is the expectation of how, where they're going to be placed in the various hospitals.
But we do have a couple of new residency programs. We have a integrated plastic surgery program that we just implemented, and we're going to have our first and second year students, residents starting in July. And then we've created a fellowship in child psychiatry with KD. And the first fellows may not come in until this July, it'll be following July, after the new children's hospital is created. We've negotiated with Mr. Darling at CHKD to fully fund those pediatric child psychiatry fellows, which will then in turn provide a workforce for the region for pediatric psychiatrists, which are in enormous demand nationally and regionally.
Okay, very good. Thank you.
Yes, thank you. Okay. So it's my screen is stuck again. So let me. All right. So clinical enterprises. The operating margin is an increase of $2.2 million from the fiscal year 21 budget. As reported, is a decrease from the projected actual due to how well they're doing this year. It also includes again, the budget, we are budgeting salary and fringes for vacant positions. They are also budgeting a decrease in PSPP revenue, in part because there was in fiscal year 21, I think $500,000 more reported as a catch up from prior years. So they do a reconciliation and a true up with this calculation, periodically. And in fiscal year 21, there was some catch up of a little over $500,000, which helped make this amount, the revenue, higher in fiscal year 21, even though the activity levels in fiscal year 22 are expected to be about the same. And then the reduction in the indigent care allocation that we've already talked about. Sponsor research includes $3.2 million of direct sponsor research expenses, mostly in the Conrad program of $2.1 million, and then in other awards, $1.1 million. Just to remind everyone, we do not budget for new awards. So we do look at this as being somewhat conservative, but without knowing, what we submit proposals all the time, and we have about a 30% success rate. So we don't budget anything until we know that we have it in hand. And then in department reserves, we have budgeted a $1.1 million net excess. We do have $75.5 million in department reserves as of March 2021. These funds have already been committed. These include our chairs funds, research funds, where we put student fees, insurance reserves. This is where we house the Hay Club renovation reserves as well. And then lastly, on the EVMS reserves, the institutional uncommitted reserves are projected to be $54.2 million at the end of June. And this includes the $5.5 million that we think we will be transferring at year end, assuming that the year continues to be on the same trend. And then in at the end of fiscal year 2022, we expect to have $56.9 million. And that concludes my report. So I will stop sharing the screen.
Thank you, Helen. So I know we had some questions during the presentation, but at this point, any other, and I know it's a lot to digest. I mean, hopefully you had a chance to perhaps preview it a little bit before the session, but is certainly if there's any other questions at this point, that you could ask.
I have a question probably for Dr. Homan.
Okay.
With the PSPP, there's a decreased PSP revenue. Oh, and you explained that earlier.
Well, that's going to be for next year. That's essentially a reconciliation of funding that we received in the previous year that we won't, it's a timing issue, essentially. We did get a bump in that this year, pretty substantial bump of 2.5 million. So the total amount, I believe, is about 6.5 million a year from the PSPP. That's the upper payment limit program. That was the first program I started here that then led to the IGT program with Centera Norfolk General, and then led to the hospital assessment program for the whole state. So we now have those dollars are essential for supporting our clinical faculty. If we didn't have those, the salary lines of those faculty would have been dramatically decreased. I know nationally that's not at risk. Because I've talked to people around the country, because I created it in Texas 22 years ago and in Pennsylvania as well. And there's no effort from the federal governments to try to reduce that, especially in the context of all of the additional funding that's coming out from the president's office to create funding for states and municipalities as well. Nobody is talking about reducing that program. When I first started it, it was going to be timed out in 2022. Then it was extended indefinitely. And right now, no one has any thought that that's going to be decreased, because all the states are now that have adopted this are so dependent on it. So I think that's calcified in the federal government's budget, and we can rely on that for an extended period of time.
Admiral, I have a question.
Yeah, good.
Can you hear me okay?
Yes.
I want to make sure I'm unmuted. Yes. So regarding the agreement with Centera that ends in December 2022, I believe, the annual funding, where are we with renegotiating agreements, an agreement beyond 2022? Maybe Helen.
As the affiliation agreement stipulates, we'll start those discussions effective July 1.
Okay. Has there been any discussions prior to now to prepare?
There hasn't been. They finally identified their point person at Centera, and it's now Jordan Asher. They thought it was going to be the president of Norfolk General, but they've gone through 5 presidents at Norfolk General in the last 6 years. And I negotiated with the previous Kurt Hoflick, who was the president of Norfolk General, when I went through the process last time. And I was just informed 2 weeks ago that Jordan Asher will be the point person for Centera now. Now, he and I are involved through the Joint Planning Committee to adjudicate the existing affiliation agreement funding. And we have monthly meetings on that. So we've had dialogues around that, how the existing agreement's going to be expensed. But we haven't been in the throes of specific negotiations at this point. And the affiliation agreement indicates that we should start that process 18 months before the expiration of the affiliation agreement, which is July 1.
Okay, thank you.
I have a question on Conrad. It was good to see we're getting an increase. I was thinking a year ago we heard that program was in jeopardy. Am I right or wrong on that?
No, yeah.
It was.
Sorry.
Go ahead, Helen.
Yeah, you were right. There was concern because they had several of their large awards expiring, but they were able to secure 2 new awards during fiscal year 21. So that definitely relieved the concerns for the program as a whole. And we were very thankful that they were able to secure them. We still moved ahead with a reorganization.
Fine, you.
Excuse me, I'm sorry.
No problem. No problem.
We did move forward with reorganization, and we have shut down the Roslyn office, and they are moving to Norfolk during this calendar year. So trying to reduce the size of the operation and making it more nimble moving forward in the future.
Thank you.
Okay. Other questions, thoughts? All right. Thank you, Helen, for that review, and to our committee members for your questions and insights here as well. All right, the next item is any new business for the committee. Okay, so hearing none then, I will adjourn the meeting and hopefully give you back a few minutes here. But anyway, thanks again for taking time out of your schedule today for this session, and we'll see everybody at our next regular board meeting on June the 15th. In the meantime, stay healthy and happy Memorial Day. See ya.
Thank you.
Thank you.
Yeah.
Thank you, everybody.
Thanks, Rob. Good to see everybody.